So today we'll be talking about very nice drug comparison, that is the medicine in between chlorthalidone and telmisartan. Now chlorthalidone is actually a thiazide-like drug, whereas telmisartan comes from angiotensin receptor blocker. Now the main difference is chlorthalidone has a very good and longer duration of action. So it acts for almost 48 hours, so complete 2 days. Whereas the telmisartan, it acts for almost 24 hours. The peak action of this telmisartan starts or peaks over a period of 2 to 4 weeks. So as the time keep on as the time passes, the effect of telmisartan over blood pressure control gets better and better and better. And telmisartan acts for complete 24 hours. So telmisartan gives a very good blood pressure coverage control over 24 hours, whereas chlorthalidone has this antihypertensive property which lasts for around 48 hours. Now, as we know, this chlorthalidone is a thiazide-like drug, so it falls under actually a diuretic. So it actually over a period of time reduces the blood volume. It reduces the total peripheral resistance. That is how it calls fall in blood pressure. And the beautiful effect of this chlorthalidone on blood pressure control or fall in blood pressure control is very gradual, and that is over a period of 2 to 4 weeks. So both telmisartan and chlorthalidone, they have a very beautiful blood pressure controlling property that actually gets better and better over a period of 2 to 4 weeks. So we know that this telmisartan with chlorthalidone, they increase the blood pressure lowering property of each other. So chlorthalidone given with telmisartan or telmisartan given with chlorthalidone causes better blood pressure control when used against an individual drug. So if someone is getting only telmisartan or if someone is getting only chlorthalidone, then when these both drugs are used together, they can have a better pressure control, and the chances of control of blood pressure will be much better if these two drugs are combined. So very commonly, the diuretics enhance the action of this telmisartan. The good thing about this telmisartan is they are remarkably free of any side effects. So this actually does not cause tachycardia, doesn't cause bradycardia, does not cause any sexual disturbances, does not cause any fainting or first dose effect. So this telmisartan, that is the reason why this is one of the first drug of choice whenever it comes to the pure blood pressure control or for the hypertension. These drugs don't increase kinin levels, so there is no cough, angioedema, or urticaria, which is the problem which is very commonly seen with AC inhibitor, that is enalapril or ramipril. So chlorthalidone also does not increase any kinin levels, so there is no cough, no angioedema, or no urticaria which is seen with chlorthalidone. So with the chlorthalidone, the heart rate and cardiac output is unaffected in long-term treatment. In short term, there may be slight increase in heart rate, or there can be slight reduction in the cardiac output, but in the long term, there is no alteration of heart rate or cardiac output. With the chlorthalidone, there is no significant huge diuresis that occurs with the chlorthalidone, so it does not cause any sympathetic reflex activation. This problem occurs with amlodipine, which is a calcium channel blocker, which very commonly causes sympathetic reflexes activation. We also know that postural hypotension is not seen both with chlorthalidone as well as telmisartan, and the blood pressure fall with chlorthalidone alone can be up to 10 millimeters of mercury. As we have said, chlorthalidone as a part of thiazide-like drug, it potentiates the effect of all the other antihypertensive like telmisartan or calcium channel blockers or beta blocker. So it increases the blood pressure reduction property of other antihypertensive drugs also. As we know, the drug of action, the duration of action is around 48 hours. Once a day dosage is more than sufficient for chlorthalidone. The most commonly combined dose is 6.25 to 12.5 milligram per day. As you've seen, that it causes the slight diuresis over a period of time. It has shown to reduce the left ventricular mass. This is the good thing about the chlorthalidone. But when it comes to telmisartan, it has so many good properties. For example, it is kind of remarkably free of any side effects. It does not increase any kinin levels. One of the beautiful thing is it retards the diabetic nephropathy. This property is also seen with ACE inhibitors. It reduces the proteinuria, which is also seen with ACE inhibitors. This telmisartan has also shown to reverse the left ventricular hypertrophy, reverse the vascular hypertrophy, and that is how it has shown to improve the cardiac mortality. Now, these beautiful things are not there with the chlorthalidone. So, when it reverses the LVH, when it reverses the vascular hypertrophy, it definitely reduces the hospitalization for the heart failure. So, when we compare these beautiful benefits along with almost no side effect, this is one of the best first line medicine to start with in in any hypertensive patient. The usual dose is around 40 to 80 milligram per day. And with chlorothalidone, there is one problem that it very commonly reduces the excretion of the uric acid. That is how it causes hyperuricemia. This is one of the problem with the chlorothalidone. So, what we very commonly do is the in calcium channel blocker, like in cilnidipine, had shown to cause uric acid excretion and reduction in the uric acid. So, if some patient very commonly when they are put on the telmisartan plus chlorothalidone combination, and if the patient has hyperuricemia, in that case we can simply change that combination from telmisartan chlorothalidone to telmisartan and cilnidipine. So automatically the cilnidipine causes uric acid excretion, and the patient can have lower uric acid. So, uh, telmisartan is the first drug of choice for hypertensive patients, for LVH patients, for those patients who have hypertension in so many years, because it reverses left ventricular hypertrophy, it reverses vascular hypertrophy, it improves the cardiac mortality, it reduces the hospitalization for the heart failure. If the patient is already on suppose telmisartan and still the blood pressure is not controlled, then chlorthalidone is the drug to be added so that the patient can have a better blood pressure control. And that's all for now. And thank you so much.